rebuilding healthcare together. We know that New Brunswick is beautiful. It's rural and urban. We're bilingual with close-knit, strong communities. We're multicultural and we're innovative. And at the heart of our communities are hospitals or community health services where New Brunswickers have access to quality healthcare services. Medicare is Canadian. It's part of the DNA of being Canadian, and that makes us proud. We know that healthcare is very important to New Brunswick's communities. In order to maintain our healthcare system, we as New Brunswickers need to ensure that our province's healthcare system is sustainable. However, right now, we're at a tipping point. We have all turned to the ER as a last resort with that nagging flu, our baby's thermometer toppling temperature, a health concern with an elderly family member. We wait, sometimes for hours, to be seen to have our healthcare concerns addressed. While our health concern may not be an emergency, we still go to the ER. Why do we do this? Visiting the ER costs taxpayers double what it costs to visit a family doctor. Double! The best place to get the non-emergency care you need is in a primary healthcare setting, such as a family doctor, family practice team, nurse practitioner, Tele-care, or a community health center. Access to family doctors is an issue in our province, yet we have more doctors per capita than most provinces in Canada. 93% of New Brunswickers have a family doctor, compared to the Canadian average of 86%. A challenge we have is that only 30% of New Brunswickers can get a same-day or next-day appointment with their family doctor. That's 15% below the national average. On top of that, only 22% of New Brunswickers can access their family doctor after hours. When New Brunswickers need non-emergency medical attention after the workday, most or 78% have to head to an after-hours clinic or their local ER. New Brunswick's doctors and primary healthcare providers are working together on improving this issue because the best place to receive non-emergency care is not in the ER, but with your primary healthcare provider.
It is all about access for New Brunswickers. We have to get in our minds that primary care and family medicine is really a team sport. I think we have to get ourselves away from a provider-focused system and more towards a patient-focused system. The patient has to be at the center of everything that we do. I think integration is really important. We've really done a good job of working alone together, but my goodness, the time is now, if it ever has been, to really help us be able to integrate our healthcare here in New Brunswick. We have to help our healthcare professionals organize themselves into teams so that our patients can get the best type of healthcare that's available to them right here in our own communities in New Brunswick.
A nurse practitioner is a nurse with what we would call some advanced education. We do all kinds of different aspects of care, acute and chronic illness management. We like to say that we treat the person, the family, and communities. Teams work together, everyone achieves more is just really important to me. In the health center, I have access to physiotherapy, a pharmacist once a week, a dietitian once a week, as well as diagnostic imaging and lab, and other sort of health providers such as nurses and LPNs. It takes the team, I think, to improve the health of a person. If there were more groups of healthcare providers, like say a couple of physicians, a couple of nurse practitioners that worked in group practices, that's improving access so the patient doesn't have to go to like the emergency department.